Our skin has oil glands known as sebaceous glands. These glands are present throughout the body, but there are certain areas of the body like the head and neck, the scalp, the upper part of the chest, upper part of the back, and the private areas like the testicle area or the external genitalia in women, which have more sebaceous glands. So sebaceous glands produce more oil in these areas, making the face, chest, upper back, private areas, etc. more oily, and other areas like hands and legs dry. So what makes some people's skin more oily and some people's skin more dry? Oil gland overactivity is related to male hormones. Those who have higher level of male hormones or those whose oil glands are more sensitive to male hormones usually have more oily skin. Most of the men have more oily skin. Most of the women have oiliness only in the T-zone. T-zone is this area, top of the forehead and the nose and the chin area. So this is the T-zone. So how do you control oily skin? First and most basic thing is washing your face 2 to 3 times a day. Washing it more than that might also irritate the skin. The second is what type of cleanser do you use? You get oil control cleansers. They are available in so many companies over the counter, or you can ask your dermatologist to suggest an oil control cleanser. The third thing is deep cleansers. Weekly once or weekly twice, those who have very oily skin can use deep skin cleansers. Some face packs also act as deep skin cleansers, so you can also use a face pack. Third is when people have too much oil coming in spite of all these things, they just touch their face and they find oiliness, then they require medical treatment. There are a group of medicines called as retinoids which reduce the oil secretion. Most commonly we give a tablet called as isotretinoin. Isotretinoin should be prescribed by a registered dermatologist after checking the patient's liver and cholesterol test and other things, and it cannot be prescribed in those who are planning to have a child, so because it can cause serious defects to the child. Other options for controlling oil at a dermatologist clinic would be using laser toning. That's a low energy laser which is done every 15 days, 6 to 8 sessions would be needed, or another procedure called as chemical peel, where certain chemicals are applied on the skin which remove the oil from the oil glands. These can be done every 3 weeks and they have very long lasting results.